Hello, hello, good afternoon, good evening, wherever you're joining us from. First and foremost, let me apologize for starting this live stream late. We are 7 minutes behind schedule. It's due to some technical issues that we were having. Thank you so much for hanging in. Thank you for joining us once again. We truly appreciate you. Again, it's another episode of Ask the Doctor, and we're so excited to have Dr. Ayo Olowo Ekere with us in the building again this month. Thank you so much for joining us last month, and thank you for coming back again, to help us talk about all these issues that we women were having. But before I have Dr. Olowo Kere come on board and dive into issues, I want to quickly introduce who we are, what we do at LifeBloom. This is LifeBloom, and we are an organization that create awareness and advocate for women related issues with a special focus on reproductive health. So that's what we do. We create awareness, we advocate, we do campaigns all over. And Ask the Doctor is one of our programs that we just started this year, where we bring experts to come and help us, to break down some things that are worrisome, that are challenging to us. And so we invite people to come in and ask the doctor yourself whatever question you have. And last month we had Dr. Ayo here. He was able to, answer some questions, really break down what endometriosis is, and why we need to take it serious. So again, thank you so much, Dr. Ayo, for joining us again. We truly appreciate you, and I want to thank everyone that is joining and that will join. If you are already on board, please share the link on your status, share the link on your page. We're live on YouTube, we're live on Facebook, and let people know that we are live and the doctor is in the building. All righty, so let's get right into it. Before we get into the question, because we already have some questions rolling in, Dr. Ayo, but briefly, I just want us to do like a recap of what you spoke to us about last week. And while you're doing the recap, I want you to also add into it that yes, for those that know and for those that may not know, endometriosis does not have a cure. But what are the few things, practical things that we can use to navigate endometriosis? And thereafter, we will dive right into the questions.
Yeah, thank you, doctor. Thank you, Funke. You're already sounding to me like a doctor, and
Oh,
I'm very happy to to confer probably a honorary degree on you. LifeBloom.
I receive.
It's okay. Endometriosis is actually a very difficult entity to understand, and it's a different ball game entirely. And for the sufferers, it's actually a big deal. It's a lot, and in our practice, we see a lot, but many of them, as we said, present with pain in gynecological clinic. At this point, I would love to run a cap. We just have a recap on what endometriosis is for the
Yes.
benefit of people that were not with us last month. And permit me to introduce endometriosis as more or less like an enigma, to be sincere. It's elusive, it's very difficult to diagnose in our environment. And let me take it home by explaining what happens in the reproductive system of a woman. A woman, as we all know, has a brain. We have the hormonal system and we have the reproductive system that responds to the hormonal milieu. So just to make it simple, the higher centers, that's the brain, that comprises of the hypothalamus and the pituitary. Permit me, to say some of these medical jargons. I don't have a way around it, really.
Okay.
So the higher centers will dictate to the ovaries. Ovaries are where the eggs of a woman are kept. Those ovaries have been there before the woman was born. Okay, so the ovaries contain eggs. So the higher centers will dictate what the ovaries will do. They will recruit some eggs. The eggs will start producing some hormones. First of which is called estradiol, estrogen, just to keep it simple. And this estrogen will act on the innermost layer of the womb that the doctors or medical practitioners know as the uterus, the uterus. So this
Mm-hmm.
womb contains an inner layer that's capable of responding to estrogen and the second hormone that the ovary produces as the progesterone. Okay, so once the estrogen comes out, it causes proliferation of the innermost layer of this womb. You know, it causes accumulation of blood, some fluids, and some other, just like preparing a waterbed. Then, after ovulation, progesterone comes out to cause a secondary thickening or secretory effect on this already proliferated endometrial layer. And that's actually when the waterbed is prepared for waiting for an embryo that is a product of fertilization from a man and a woman meeting and getting
Mm-hmm.
pregnant. So the embryo lands in the prepared waterbed and pregnancy
Mm.
ensues. Now, when pregnancy doesn't occur, that sheds in menstrual flow, which is usually popularly called the wailing of a disappointed womb. So it is when pregnancy does not ensue that the uterus will shed its content and the woman will menstruate. So now, this innermost layer of the uterus is only meant to be inside the uterine cavity alone. But for reasons known to science and for some other reasons, we find them in other places of the body, in other parts of the body. Imagine it in the brain and it's responding to that hormones, and the hormones are now making the brain have a particular cell that releases that causes accumulation of blood, and then you can find it in the lungs, you can find it in the abdomen, you can find it anywhere in the body.
Mm.
And that is endometriosis. So you can find it in the pelvis, you can find it inside the ovary itself, you can find it within the bulk of the muscle mass of the uterus, and that is endometriosis. So you can imagine that the symptoms are open. They can be anything, depending on the site that these endometriotic nodules are deposited. And it's very commonly found on the ovaries, in the pelvis, and some other places. So now, how do we cope with the challenges of an endometriotic patient? It actually depends on what the patient presents with. Usually pain, because imagine that kind of a tissue on the nerves. It's going to irritate the nerves, it's going to cause pain, it's going to cause a lot of things. Pelvic
Mm-hmm.
adhesions can occur, it can affect a lot of things, infertility among others. So when we see them, of course, we have we scale up analgesic preferences, and we can actually help them. Non-steroidal anti-inflammatory drugs, and among many other oral medications, or even sometimes parenteral medications. And some of them may actually require surgery. Can be minimal access, can be open surgeries, just to give them a good quality of life. So it's actually a whole lot. And
Mm.
we keep talking about endometriosis. Thank you for bringing it to the fore, because it's a very common condition. About 3 to 10% of women in the reproductive age group, which is about that's about between 25 and 45, or 20 and 40, or 45 in the active reproductive age group. About 10% of them have this condition, and many
Mm.
of them don't know. They might just think, oh, it's just a painful menses, or I just have chronic pelvic pain. And about
Yeah.
25% of women that do not have children, that are having infertility, actually is due to endometriosis. Up to 35%. That's a lot. It's
Mm.
huge of the burden of infertility of infertile patients. And I must tell you too, sometimes when we remove the uterus for any other reason. Sorry?
No, no problem.
Yeah, sorry, I was coming. So
No
for
problem.
women that we remove their uterus for any other reason, probably fibroids and endometrial or some other reasons, About 10% of them, when we do gross histology, we find endometriotic nodules within the uterus. And almost about 30 to 35% of patients that undergo laparoscopy for anything. It can be open laparoscopy, it can be for infertility evaluation, it can be for anything. About 30% of them, or even up to 35% of them, will find endometriotic nodule incidentally. So it's actually a big deal. And many people that say, oh, I'm done with childbearing, I don't want a child again, up to 2% of them, as old as they are carrying endometriotic nodules in their bodies. So
Mm.
almost 10% of patients generally that come to the clinic for one gynecological challenges or the other are having endometriosis. 10%. I must tell you, is a big deal.
It
So
is.
we
It
should bring
is.
it home. We should bring it
It
home.
is. Thank you so much for breaking it and giving us that short recap. So what do you think before we dive into the question? We already have like a couple of questions here. All right, let's just dive into it. Number one question that we've received says, I I noticed that during my period, my ability to carry out daily activity reduces significantly. I feel mentally slower, al- almost like my IQ drops. So she's asking why and what can be done to improve it.
Well, my thoughts with that patient, really, it's actually a lot. I must
Okay.
confess to you, women are actually the real deal. They are going through a lot to keep the world going.
Okay.
Remember, I told you, kill all the women, keep all the men alive, the world will go into extinction. But do the reverse for the men. Just keep one, or probably somebody spams. The world will continue. So it's
Mm,
my thoughts are with you that your menses play so much on you like that. But I must tell you that it's not only endometriosis that can cause this kind of condition. So that person will actually need a detailed gynecological review. There's a
mm,
condition we call premenstrual syndrome. There's a condition we call premenstrual dysphoric syndrome. There's some psychological aspect of menses that could actually play pranks on a woman these ways.
mm.
Also, endometriosis is not innocent too. You know, it can affect the behaviors and some people, because of the kind of pain they feel. You know, pain has a way of resetting your psyche. It's a whole lot. Labor pains, you know, pains of endometriotic nodules, labor pains of malignancy, among others. They are actually, a person can actually shut down from pain.
Yeah.
That's what we call neurogenic shock. At the height of pain, a patient can actually die just from pain. So pain is a whole lot. And the good thing about gynecologists, we are wound creators, we are pain specialists. So let them talk to us. So I think that patient will need a whole lot of evaluation. We need some investigations. We need behavioral therapy. We need physical therapy, and we can actually help a lot.
Mm. Hmm.
Please,
Wow.
maybe behind the scene, the person can actually talk to me. I need to clack. I need to evaluate that person. No matter how far the person is to me, we can actually still put our
Still
weight
help.
behind the
Oh wow,
woman. And
thank you so much, Dr. Ayo. So after the program we will connect you and that person together. Thank you so much for offering to do that. So people, I hope that you are taking notes and you understand what you just said. Something caught my attention when you were talking. You said someone can actually die from pain.
exactly.
That is serious. So
Yeah.
when we go out there and our watchword at LifeBloom is pain is not normal, because as women we've been conditioned to feel that culturally, because of our culture and everything, we've been raised and conditioned to feel that pain is normal and it's something part of what we as women we need to endure, tolerate, and just live with it. But I hope that you guys had when the doctor himself said it, that pain is not okay. It is not normal for anyone to be in pain. So please and please stop enduring pain. Seek help, and you'll get the right support. The number two, I think the number two question says, I struggle I struggle with mathematical calculation and critical thinking, and I avoid tasks that requires intensive focus. I'm concerned about what this means long term. I don't want to get pregnant and experience memory loss or feel less intelligent. What can I do about this?
Well, I don't think pregnancy has a way of lowering somebody's intelligence or cause memory loss. No. In fact, I must tell you, pregnancy hormones are like dopes on a woman. Do you think it's easy for a woman to be going around with loads, carrying a whole human being in your tummy? And look at them, they carry it with pride. Simply because pregnancy hormone has a way of elevating your mood. It makes you feel high. It makes you feel the ginger. It makes you feel cool about yourself. So I must tell the woman not to be afraid of getting pregnant, because pregnancy can actually improve the mentation, can improve your psyche, can improve your psychology once you have good pregnancy support. Because the commonest cause of low self-esteem, puerperal blues, psychosis, all those psychological challenges in pregnancy are when you don't have good pregnancy support. And a lot of people don't know what it means to support a pregnant woman. It's not about making food available, it's not about making money available. Good pregnancy support. And that is why we are here, to educate a woman and her husband. It's a journey. And there's something we call birth preparedness, complication readiness. We prepare couples. We talk to them during pregnancy. We make it a sweet and beautiful experience. So you should not be worried about the pregnancy. But now, about what she's going through right now, but I think she might need to talk to maybe a neurologist. I don't know how old she is. I don't know what the precipitating factors are. I don't know whether it runs in the family. I don't know whether there are some other risk factors that might actually be like an organic. Look, let me tell you one funny thing. A lot of people carry some lesions in their brains without knowing. There are some lesions in
Mm,
the brain that are so silent. That is when you talk to the neurologist, the neurosurgeons, that they find out some of these things. And as silent as they are, they can actually nip them in the bud. So I think generally, we don't need to sit on it. For example, there was a patient that I think several years ago, the man, he was raining outside. He went to close the window of his, roll up the window of his car. He rushed in. He slipped and fell, and suddenly he started forgetting things after certain weeks, some weeks after the incident. The fall was trivialized. So he started forgetting things. He started, you know, having difficulty remembering things. And somehow the brain is very smart. When you forget, the brain trying to replace your memory loss. That's what we call confabulation. So the man started
mm,
confabulating. They started talking out of context. That was when the wife called me. Say, oh, my husband, this and this. And I said, you said he fell. Could that be that he's probably having a venous bleeding somewhere in the brain? And I quickly
mm.
called my friend as a neurosurgeon. And before you know it, he has a big blood collection somewhere in the brain.
My
Simply
God.
because it was venous. So it was slow. It was, he also giving him intractable headaches. Then later he started forgetting his name. Then later when he wanted
Mm,
to, he would not be able to remember the right words to tell people that I want to wee. So he will urinate on himself.
mm,
So it got so bad, then he had a borehole and he went home beautifully okay. So most of these things I will sit on are actually organic issues. And if they are not, we are trained to know. And once we rule out the organic issues, we talk about the psychology, they are readily available. So let the
mm.
person talk to not me, but you can look
In
for a GP.
neurology. Okay.
The GP will be able to triage and know that, oh, this is who you need, this is who you need. And it might even be a very simple thing that the GP will be able to sort out.
Mm. Thank you, thank you, thank you, thank you. One of the major reason why we started doing Ask the Doctor is because a lot of us, whether women, whether men, young or old, we sit on things. Things happen and we sit on it. And I realized that there's some things, information out there that a lot of us don't even know. A lot of things that we deal with that, you know, just only if we have the opportunity to speak to an expert in that field, everything will be resolved. Take the example of the man that you just gave now. If the wife had not called you and you called your friend who was a neurosurgeon, you know, maybe that was how the man will be going down the drain and eventually will pass on, you know. So that's a lesson. And I want people to realize that we're doing this to benefit the community, you know. So help us to share it. Help us, even after we end the live stream, still share it to be saved on YouTube and on Facebook. Share it, make your comment, put in your question. We'll continually review it. All right, let's go to the next question. This question is very funny. Is that sorry, it's not funny, but um, there's an heightened sexual urge just before, during, and after my period, but I don't allow my husband because my breasts are tender and my mood mostly don't match with what my body wants.
Oh
What
my,
can I do?
oh my word. See, I
And
put
a
it to
lot of
you.
thank you, the person that asked this question. I want to thank you for the courage to ask this question, because the honest truth is a lot of women, married women, are in this situation, but the shame, the stigma of why would I ask this kind of question, especially on live show, and all that, will not allow it. So thank you so much for bringing this out. Over to you, Dr.
Yeah,
Ayo.
I join you to thank that patient, for the courage to ask that question. But let me tell you one beautiful thing, that our body is a perfect system. I told you that menstrual flow is the wailing of a disappointed womb. What God has programmed menstrual cycle to achieve is pregnancy. And I'll put it to you that the last 14 days of every period is constant, because it's characterized by ovulation and ovulatory events and post-ovulatory events. And one of them is tingling sensation of the breast, breast fullness, increased libido. And if that woman will look very well at that time, the mucus, that the cervical discharge, the discharge from the vagina will change around that time, to have this clear, elastic look that we call spin bucket, that you can actually pick it within your nails, and it's actually very elastic and clear. It's simply because the body wants the woman to have sexual intercourse so she could get pregnant. Majority of
Hmm.
our patients with delayed fertility, the only challenge some of them have is they are missing those days.
Ovulation.
And I put
Ovulation.
it to you that in a whole cycle, the book says about 48 hours. Yeah, when you release your egg, the egg stays about 48 hours thereabout. But in real practice, about 24 to 48 hours, less than 48 hours. The rest is form. So if she truly wants to get pregnant, that is the time to have the coitus. Her body has given her all the signals, all the signs, and they are there looking at her. You understand? So that's not the time she should run away from the spouse, and get to do other things. The body is trying to give her the signal that, oh, it's time for coitus, so I can get pregnant. She has just ovulated, and the egg is waiting, or the eggs are waiting. If there are two eggs, you give birth to twins, and if there are three, you give birth to triplets.
Wow.
So yeah, that's how God works. So the tingling sensation, yes, but the husband will just be gentle on the breast, and it's all about understanding.
But what
And
about the
again,
mood?
yeah, that's where I'm going. The mood, it might be a component of premenstrual syndrome. Some people have that immediately after ovulation and disappears when menses come. So that mood signal is actually telling her that she's running an ovulatory cycle. So
Mm.
yeah, it's a signal, because premenstrual syndrome is common in ovulatory cycles, and that's what some people are looking for, so they could ovulate and get pregnant. So in patients that are having anovulatory infertility, we have to force their system to ovulate. And that's why what she's having for free. And she's running
Hmm.
away from it. So
Hmm.
it's knowledge is power. When
Yes, it is.
yes, well, now that I've told her, if she desires of fertility, she just even if there's a quarrel before then, that's when you make out with your husband, you make sure that you cook good soup for him, and everything
Oh,
is
wow.
so we can have clients. Me, I want clients.
Hmm.
So, and I'm sure every OBGYN anywhere wants clients, because
Hmm.
we've got a lot to do around. And
Yes, yes, yes. Thank you. Thank you so much for helping us to answer that question and explain it in a way that everyone one can understand. I have been in that shoe before, especially when I was really in the thick of that endometriosis mess. Oh God. But thank God for having an understanding husband, and and that also has an idea of what I'm going through and everything. That really helped. All right, the next question. Our next question is there a way to improve my hormones? My husband is beginning to complain. Is there a
What does
way to
person mean
improve
by
my
hormones?
hormones?
Probably
Yeah.
libido. Yeah,
Well,
yes,
yeah,
what
I think,
one
yeah, you can talk. She didn't mention anyone. She just said hormones. So I
hormone
want you
is
to be
that
general
that's
about all
quite
the
an issue.
hormones.
Which hormone? There's a lot of hormones, but I
But
guess
when she says her husband is beginning to complain,
yeah,
so
that's the libido. Maybe she doesn't have so much urge, and the husband wants. Yeah, it could be actually cranky. Yeah, when a woman is not always in the mood and the man wants it, and she's not all well lubricated for him and all that. So it could actually cause it's one of the leading cause of marital disharmony. And
hmm,
um, the
so
thing
what can
about
she do to improve that?
exercise, eat healthy, take a lot of vitamin E, multivitamins. It helps mop up free radicals, improve your state of mind. You know, sleep very well. Do a lot of exercise. Aerobic exercises. It has a way of improving your hormonal system. And it improves the libido. And
Okay.
I must tell you, it's actually a good option. Yes.
Wow. 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 Interesting. I've never had that before. Well, maybe I've not paid attention to it that exercise actually helps. So it's not as if it's medication that you have to go and buy. There's no excuse that I don't have money to buy it. You know, just sleep well, exercise, eat good food, nourish, balanced diet meal, and that would resolve itself. Alrighty. Our next question: what are those blood clots? Looks like liver that flows out of the blood.
Blood
So
clots from where? From which part of the
during
body?
your period, during period, sometimes you
Okay.
have some blood clots,
Your,
heavy blood clots, especially when you are having heavy flu.
okay.
Yeah,
Okay.
so she's asking what are
The
those?
reason why mm, the reason why blood will clot during menses is because of excessive flow. The reason why blood will clot during menses is because the menses is heavy. You understand? And that is, the fibrinolytic system, the system that lyses clots, has been overwhelmed because the excessive blood is now the blood volume that's coming out of the menses is much, so it has time to clot. You understand?
Mhm.
So that is that. So the only thing we have to do is to make sure we treat the cause of the excessive menstrual flow, which might not be far-fetched. Endometriosis can cause it. Adenomyosis is an example. It can cause it. And fibroid can cause it. Dysfunctional uterine bleeding can cause it. Hormonal issues can cause it. When you have premalignant lesions can cause it. Yes. My iPhone cord. Your
Okay.
Google. Yeah, please.
So um yeah. So before we go, well, as we wait for more questions to trickle in, I want you to explain the difference between adenomyosis and endometriosis.
Okay.
Are they the same thing or are they different?
They are the same and they are different.
Okay.
And I told you endometriosis can be found anywhere in the body. Adenomyosis is also known as endometriosis interna. That's when you find the endometriosis nodule inside the muscle bulk of the uterus itself. The endometriotic, the endometrial cavity that contains, the innermost layer of the uterus. That's the endometrial layer. It's meant to just be confined to the innermost layer of the uterus. But when you find it inside the muscle bulk of the uterus, yes, that is adenomyosis.
Mm, mm, mm. All right. Thank you so much. Thank you for helping us to differentiate both so that people don't mix them up. I guess my other question would be, so endometriosis does not have a cure, and we all know this, and we've been creating this awareness about it and all that. How can a woman or a young girl, a girl child that is dealing with endometriosis, how can they manage it so that it doesn't take hold of their life? Because it's not properly managed, then it leads to so many other things. It leads to depression, isolation, and all that. Please bear with us. Dr. Ayo's network has been going back and forth, but I'm sure he's hearing me. So how can we, anyone dealing with it, manage it and manage it well so that they will still be able to have a life outside this pain and navigate through it?
That's our job. To keep them
Okay.
as pain free, as symptoms free as compulsory,
Okay.
because a patient actually doesn't deserve to be in pain. You know, nobody deserves to be that, and that's why we're trained. And
Okay.
when they present early, it helps. Yes, when a patient comes in early, oh doctor, this is what I feel. Well, it's unfortunate in our environment. A lot of people feel they know why they have a particular condition, and therefore
Mhm.
they tried home remedies, they tried other unorthodox remedies, which may actually either worsen the situation or not help at all, or damage some other things in their body. So, but for patients that present early, it's actually a piece of cake. You know, once we have been able to make a diagnosis, again, that's where another challenge comes in. Nigerian doctors, as I've told you, we do a lot to go around cycles to make things work, to make diagnoses, and to help our patients. Because the diagnostic instrument for confirming the diagnosis of endometriosis is laparoscopy, and it's not readily available in our environment. But with our clinical acumen, I'll give you for free. And Nigerian doctors are trying, because a lot of us make diagnoses with close to nothing to work with, and our diagnoses are usually as spot on as you can get. So for patients that come early, and for those that can afford the diagnostic procedure, yeah, they do it. The laparoscopy, we see it. During the laparoscopy, we can burn off some of these endometriotic nodules when we see them. We can
Okay.
coagulate them, we can cauterize them, we can excise them, we can burn off them. And laparoscopy is not far-fetched, to be honest. It's in Ekiti, it's in Ondo there, but it's meant to be everywhere, just like X-ray, just like open surgery. It should be, even laparoscopy should be in secondary facilities, maybe primary
Mm.
essential. It should,
Yes. Yes.
but you have it only in few probably private facilities around. And
Mm.
even the government facilities, the tertiary facilities are lagging behind. So it makes it difficult for you to put a lid on it, to be able to put a foot down that, oh, this is endometriosis, and can actually help this patient. Imagine you going for laparoscopy and they'll be able to remove the nodules for you, and you go home the same day, you are fine. So for those ones that do not have the facility to do the laparoscopy procedure, and we are still in high suspicion of this condition, you give them pain relievers. You can give them non-steroidal anti-inflammatory drugs, which will suppress the inflammation, will open blood vessels to the area, wash off the substance P, and they can actually live well. And they don't have to be on it continuously. It's just probably intermittent around the menstrual period. You just give them very good analgesic and all that. Then you can go to centrally acting analgesias, opioids, among others. Then you can still use some psychotherapy. For example, a woman in menopause, that menopause is playing pranks on, rushing to the clinic and thinking the world is coming to an end. And you, the doctor, ending up telling her that, oh, thank your star that you've grown old enough to experience menopause. That it's not only you, you are not alone. There are thousands of women in your shoes. If you don't give that woman paracetamol, she goes back home better than she came. Because now you've let her know that the world is not coming to an end. So, she knows the world is not coming to an end. She knows she's not alone. She knows that it's a new lease of life now. it's even grace that she had not, a lot of women had died before approaching menopause. I told you about 600,000 women die every year due to pregnancy and its challenges. You can imagine that about 250 pregnant women dying every 4 hours. You know how many
Wow.
4 hours you've had today?
Wow.
That you can do the math. That's about 250 pregnant women locked in a jet. It's only a jumbo jet that can carry 250 passengers. You are now locking 250 pregnant women and you are crashing them every 4 hours. That's a big one. So for this
It
woman
is.
that approached menopause is a lot. So if you tell her that, oh, you are one of those people that you went through your reproductive career on skates and you are here. If you don't give her anything, she goes back home a happy woman. So that's where counseling, comes in endometriosis too. So when they come, you let them know that they are not alone. That more than 10% of patients that will come to my gynecology clinic are having this. More than 30% of patients that will be evaluated for infertility are also suffering this. And more than 30% of patients presenting with chronic pelvic pain will have eventually diagnosed of endometriosis. So she feels better that she's not alone. But now takes the burden off her a little. Then you give medications, medical therapy, and some other, therapy, psychotherapy, behavioral therapy, and some other things. Then, if all those now fail, you can go in, even if you don't have laparoscopy, you can go in open surgery, take out the nodules. But the problem is they can grow back, they can come back.
Yes, they
They
are
can
progressive.
we talked about it last month that it can recur, it can be progressive. And again, if it gets so bothering, we suppress the ovulatory system. You just put the ovaries to sleep, you stop producing hormones, then your woman lives well. And the funny thing about it is that by the time you cause a pseudomenopausal state, the endometriotic nodules will atrophy. Atrophy means they shrink and disappear. So
Mm.
yeah, that's what we get. So, and after you've taken off your drug, before the endometriotic nodules remember that, oh, it's time to come back to cause trouble. Even during their period of sleeping, when they are shrinking, the body immune system will mop them up, and the woman can actually be free for years even after stopping the drug. And most especially for patients that do not need fertility anymore, maybe she has completed her family size, just suppress the ovulatory system
And
for a
put
long
them
time.
to early menopause.
Yes, and it's actually very easy to do.
Wow.
So just
Wow.
know that with medications and everything, we just provide progestin. There are some that work for years. Just put it in her body and she stop ovulating. Estrogen stops coming out, progesterone stops coming out, and all the endometriotic nodules they provide, the uterus itself will provide everything. So she can. We have a lot of options. You
Hmm.
understand? So
Yes, yes,
bring.
yes. Yes, yes. I hope that our viewers are really, really taking notes and paying attention. I intentionally asked that because I know that laparoscopy is not easily accessible, especially in African country like Nigeria, and I know that even when they're accessible, they're expensive. Like I kind of did my research and I discovered that doing a laparoscopy is almost 1 million. And so when you go do a laparoscopy just to get a diagnosis, not the treatment now, people feel discouraged. So I ask the question so that people can have a better understanding of some other options, that you have, even while you are still, you know, whether looking for money or trying to access laparoscopy, there are some other options. You just need to ask, you need to speak up, like we say at LifeBloom, you need to speak up and seek help. Silence does not help anyone. So we encourage everyone, if you're dealing with endometriosis, adenomyosis, PCOS, even though we're not talking about PCOS today, or fibroid or infertility, speak up, ask questions, reach out to your doctors, gynecologists. And I have no problem about other doctors, but these gynecologists are out there. They've gone to the school to learn how they can help us as women, and that's what they're trained for. That this is why we're bringing Dr. Ayo and some other people that will bring. That's what they're trained for, to help us. We have one more question here. Um, this person said, "Can you please share a list of routine medical exam a single lady can take to ensure she's in a good shape?"
Hmm. Okay. Well, let's start from. You mean medical examination or
Yeah,
investigation generally? Okay. Yeah, I
like
get you.
routine medical exam that they can do just to make sure, they're single, or maybe they are even engaged, but they just want to make sure and have peace of mind that everything is okay, and.
Yeah. The first thing is self-examination. You know your body.
Yes.
Let's start from there. From home, you should examine yourself. If there's anything that's not there, before now and you now find it, you report early. For example, you must check your breast every month, preferably from the fifth day of your cycle. How do you know the fifth day of the cycle? The day your menses come out is the first day. So from the day five, around day five, six, thereabout, check your breast so that the effects of the menses will be off from the breast, the ovulation and all that. So the uterus is not proliferating. So anything you find in the breast around that time is actually there. It is not
Mm,
an hormonal effect. So if you feel any lump, most especially painless lumps, they are sinister. When you find something in the breast and it's painful, it's a good news, a better news than when you find something in the breast that is painless.
mm,
Then when you see discoloration of the skin of the breast, or you see dimpling, or you see nipple retraction, rather than press your nipple and milk comes out, you start seeing blood, or you start seeing some funny swelling in your armpit, you should report to your doctor. Then if you notice that you are losing weight, or you are not really able to eat well, you should talk to your doctor. You know, okay, be that as it may, you may not actually be able to see many others, but if you notice any abdominal swelling, progressive abdominal swelling, that should point out something is growing down there in the tummy. So it could be an upper abdominal tummy, but most especially the common guy around that place is the uterus, that can start growing fibroid. And many people don't know. I've asked many patients that, who found this fibroid? Oh, it's my husband. So why didn't you see it yourself? Why was it your husband that saw this? And it's usually very funny. We laugh over it and that's it. But the woman can actually pay attention to some of these things. You check your tummy, you check your breast, you check your armpit, you look yourself in the mirror at your body contours, at the bone. Are there more bony prominences? Are there, like that? Then also we are talking, that one, all those ones are more in line of tumors. But what if you now have abnormal hair growth on your face, you start having recurrent pimples and all that? You could point to the fact that you have elevated levels of male hormones, which is not a big deal anyway. It's just there, and it's just for us to worry about. It's not for you.
mm,
You just come around. So that's what we call asceticism. You have to shave your beard once in a while. You have mustache, or you have recurrent hair growth, or you notice that your voice has deepened a little. You check your chest, you start seeing hair growth. Then you check your tummy, you start seeing hair growth coming to your navel. So that's male pattern of hair distribution. You might actually have elevated levels of male hormones that may interfere with your ovulation. So when you want to get pregnant, or probably you don't want to get pregnant, you may not be able to correctly time your ovulatory system. You
mm.
understand? So it may actually be a problem. You know, it may actually be a challenge. John, are you following me? So it may
Yeah.
actually be a challenge that way, that you are not ovulating when you expect to ovulate. So it makes it difficult for you to do your timed intercourse if you want to prevent pregnancy, when you don't want to get pregnant. So you just get pregnant when you are not prepared for it, or you don't get pregnant at all and you start bothering yourself. So if you notice any weight gain in your body recently, weight gain, there are some events that occur in the peripheral fat that interferes with your ovulatory system. That I don't want to go so deep, but there are some kind of estrogen. There are three popular types of estrogen. One is estradiol, which is the good one. One is estriol, which is found in pregnancy, and one is estrone, which is found in the peripheral fat. So when you have people that accumulate a lot of fat, obese people that recently gained weight, you have a very high level of estrone, and estrone will deceive the system that, oh, this is a form of estrogen, so the ovaries will just go to sleep. Yeah, after all, there's estrogen in the system. Why am I still producing my own estradiol? So that one will suppress the hormone system, and the patient will not ovulate and get pregnant. And the pregnancy in such situations may get prolonged. The menstrual flow rather may get affected. The menstrual cycle becomes prolonged. The quantity of menses that come out becomes reduced. So the patient doesn't menstruate the way she used to menstruate before. So it becomes a concern. So
Hmm.
now, when you come, the rest is left for us to do routine checks. Like a woman is supposed to at least start pap smear from I think 21 thereabout.
Oh,
You know,
really?
yeah, you should do pap smear. You do it at maybe
Oh,
once
yes,
in
yes.
yes,
Pap smear. Yeah, pap smear. I
natural.
thought you were talking
Because
about
it's
mammogram.
actually a very beautiful, easy test. In
It
our
is.
environment, it's about 2,000 naira, and within 10 minutes or
Really?
5 minutes,
That's cheap.
you are taking the sample. It's so cheap, and it can detect cancer of the cervix 10 years before it occurs.
Hmm.
Yeah, and I've saved a lot of patients with pap smear, ordinary pap smear. There was a woman, she has completed her family size. She just did pap smear and it was abnormal. So I sent her for a cone biopsy of the cervix. The cone biopsy came out abnormal, just pre-malignant lesion of the cervix. Then she was like, no, why would this doctor just label me like that? I said, oh, let's yank out this uterus, let's remove this uterus. She said, no. She went to another hospital. They did the cone biopsy, they didn't find anything. So she came back to laugh at me that, oh, doctor, they didn't find anything. So I told her, what about you requesting for our own block from my facility? Let them look at the block, the slide we prepared in the other hospital, whether they will agree with us or not. So she was looking at me, what kind of a demonic doctor is this? So she agreed. So I spoke with her histopathologist. They released the slide. They took it to Ife, and they checked they took it to Ibadan. They checked the slide. Oh, there's something here. I can tell you for free. We removed the woman's uterus. It's fine now, very much fine. And that's what could have aggravated her life if it progresses. So
Hmm.
pap smear is it. We should all do it. Some people add the human papillomavirus screening to it, which increases the sensitivity of pap smear. The mammography is also available, which is a low dose X-ray for the breast that can pick breast cancer or pre-malignant or malignant lesions of the breast several years, almost 10 years before it actually comes up. And we know breast cancer does not forgive. Very, very unfortunate. It doesn't.
Mm-hmm.
It's a very difficult cancer to manage because some people are even postulating that breast cancer is actually a systemic disease just manifesting in the breast, because prophylactic removal of the breast sometimes may not actually be the solution. But that's not for public consumption. At least let's do our own. Let's look out for this thing. Then there's another thing for a woman, though, because I'm sure it's a woman that's asking that question.
Yeah. Mm-hmm.
Colonoscopy. Do colonoscopy. Once you are 40 years, you should be doing colonoscopy as frequently, maybe once in 3 years. And if there's a risk factor, there are some families, we call them Lynch 2 families. Lynch 2 families have inheritance of genes that predisposes them to cancers, some kind of cancers. And how do you identify Lynch 2 lineages? Somebody has breast cancer in that family, another person has intestinal cancer, someone else has gastric cancer, another person is coming down with ovarian cancer. It doesn't have to be in the same person, different relatives, maybe one uncle, maybe one aunt somewhere. So by the time you link it together, this patient is likely coming from a Lynch 2 family, and such a person is more predisposed to having these malignancies more readily. So they should start their screening 35 to 40. While people like
Hmm.
us should start our colonoscopy 45, 40, 45, thereabout. And colonoscopy, you will still have another one. I think rigid something sigmoidoscopy. It's for the general surgeons to do. But you can have, it's a clinic procedure. They just put a scope in your colon, they see the lesions, they see anything. If there's nothing, they'll give you a clean bill of health. And if there is, they'll take a biopsy and send it to the lab for evaluation. And then again, those are the sinister ones. We can do regular blood pressure checks, at least once in a month. You should check your blood pressure, then check your blood sugar at least once in 6 months. And there's this glycated hemoglobin that should also be done that can tell you your glycemic control in like 120 days before then. That's about
Wow.
4 months, 3 to 4 months. You can get it done. Those ones we check for all these challenges, So there are lots. And again, very importantly, an average patient should be able to walk into a clinic and say, I want to do a detailed health check
Mm.
once in 2 years. They shoot a chest X-ray. They take for the men. They will take your PSA. They check your prostate specific antigen. Then for the women, we do our routines. It's not only malignancy that can kill. There are some other conditions. Hypertension is there. Do you know
Yeah.
that people don't check their intraocular pressure so regularly? And a lot of people go blind from glaucoma because glaucoma
Mm.
doesn't have any symptoms. You just go blind. So once in a while, you go to the ophthalmologist, let them check your intraocular pressure, let them tell you it is normal, let them tell you it is elevated or it is borderline, and we can actually do a lot. Because preventive medicine is actually the key. It's a
Yes, 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 yes.
it's more expensive managing this disease than preventing them.
Preventing it.
Yeah,
Prevention is the cure.
yeah,
Thank you so much. Thank you, Dr. Ayo. You've said a lot. You've said a lot. So if you are here, go back and watch this. I encourage you to share it on different platforms, YouTube, Facebook, IG. We're working on it. We're working so that by next month we'll be able to go live on more platforms. But as it is right now, help us to share it. There's so many nuggets that Dr. Ayo has given us today, especially with this last one of routine medical checkup. Things that, prevention is better than cure. And you know what? Knowledge is power. Information is key. When you have it, use it. I can't believe that pap smear is just 2,000. So nobody should be saying that they cannot afford to do a pap smear. You understand? And all these things, like you said, you every year or every other year, you can go in and request for a detailed, routine medical exam, and it's better that way. I want to encourage everyone, if you're joining us or you are watching this, please take your health serious going forward. Let us be preventive than, at the end of the day, coming back with all these things, and then we have to now spend money upon money upon money. I pray that God will help us and provide for all our needs, you know and all that we need, the resources that we need, even to take care of ourselves and be in a better health space. Again, once again, I want to thank everyone for joining us today. Thank you, thank you, thank you so much. We truly appreciate you, and I'm so sorry that we came on a little bit late. We were working on some technical issues behind. And again, I want to say thank you to Dr. Ayo, my very own Dr. Ayo. You'll
yeah.
be seeing Dr. Ayo on this channel. We'll give him some break, but you'll be seeing him often on this channel to help us dissect something. Thank you so much, Dr. Ayo. You have truly,
That's
truly been a blessing to us, and we truly appreciate you. This is where we'll call it a day today for this month. And we look forward to seeing you next month on another episode of Ask the Doctor. Continue growing, continue learning, and continue impacting life. Bye and God bless.
Bye, and stay out of trouble and
Yep.
stay fit. Prevention is better than cure.